We're going to take about 5 minutes and go through some initial vent settings to use when you first set up a ventilator. So you've just intubated your patient, your respiratory therapist is asking you for vent settings, and you have that deer in the headlight look, and you don't know what to tell her. With this video, you'll be able to quickly give initial vent settings that'll maximize benefit to your patient, but more importantly, minimize harm. So when you go to your vent, the first thing you want to do is measure your patient. We've already measured our patient, Dr. Atherton, and he is 70 inches tall, and that's very important. You're going to go to your vent, and you're going to place them in assist control mode of ventilation. With that height that you got on your patient, you want to look at your your tidal volume table, or you can use the calculator that's on MD Calc and get their ideal body weight, and set your tidal volume to below 8 mLs per kg of their ideal body weight. Dr. Atherton at 70 inches, his max tidal volume will be 580 mLs. So again, we want to stay below that. So we have his tidal volume set at 500 mLs. So we've gone to assist control. We've set his tidal volume based on his height. Your respiratory rate, you typically want to start between 16 and 20. If your patient's in a lot of distress, if they really need to get those CO2 levels off, you can go higher. If their lungs are pretty good and they were intubated for other pathology, you may need to go lower, but 16 to 20 is a good starting range. And then finally, your FiO2. You want to give the lowest possible FiO2 to maintain a saturation of 90%. Oxygen is a drug that if used inappropriately is harmful. So I typically start at 30% FiO2 when I can. As you go up on your FiO2, also go up on your PEEP. You've got to have a PEEP table. This is straight out of ARDSnet from 2000. As you go up on FiO2, go up on PEEP. If you find yourself on 100% FiO2 and 5 of PEEP, you're wrong. You've got to go up on PEEP. So to quickly review, when you first set up your vent, go with assist control mode ventilation, measure your patient, set their tidal volume based on their height, set their respiratory rate between 16 and 20. You may need to go up for high CO2 levels, or you may need to go down for healthy patients. Set your FiO2 as low as possible to maintain a saturation of 90%. And as you go up on FiO2, also go up on PEEP according to a PEEP table. So just a couple things we wanted to go over in addition to the video. I said set your mode to assist control or AC mode. And then if you looked at our ventilator, you probably noticed this. CMV is really an outdated term, but it's still on a lot of ventilators, including the one we're using here. Anytime you see CMV, that's the same as AC, that's the same as assist control. In the early days of ventilation, there was a difference, but now on all modern ventilators, all these things are talking about the same thing. So when I say start in assist control or AC, CMV, whatever your vent calls it, start in that mode. Finally, we didn't mention inspiratory time or inspiratory flow. This is what I usually start at, 0.8 or 70 liters per minute, depending on what kind of vent you have, determines which one of these you'll set. Your respiratory therapist should take care of this for you. The only thing that I would add is if you're going up on very high rates or if you have a patient that's breathing very fast, you're probably going to need to shorten that inspiratory time or increase that inspiratory flow. These are the graphics we had up on the screen. These are our tables we use here in our shop. We've got them these size because they can be easily printed off and placed on the back of an ID badge. We'll include these in the notes below. If you want to print them off, you're more than welcome to, and keep them with you for when you set up ventilators. So let's quickly review with the vent one more time. So I'm going to set my mode to assist control mode of ventilation. I'm going to set my tidal volume based on the tidal volume table of less than 8 mLs per kg of ideal body weight. I'm going to set my respiratory rate at 16 to 20 breaths per minute, depending on how distressed my patient is. I'm going to use the lowest possible FiO2 needed to assure a sat of 90%. And as I go up on my FiO2, I will go up on PEEP. This has been how to set your initial vent settings in about 5 minutes.